Well, it's my pleasure to host Dr. Bill Williams this morning. He's the founder of Solstice Dental Advisors. Hello, Dr. Williams.
Good to see you, Marianne.
Thanks. And he's also the director of the 5 Million Masterminds, a program where dentists learn efficiency, productivity, as well as marketing and managing successful multi-million-dollar practices. Over his 45 years in practice, he's been a noted international speaker, business coach, #1 best-selling author, and clinician, while maintaining a thriving practice in Suwanee, Georgia. And as far as his accomplishment, he's achieved mastership status from the most reputable International College of Craniomandibular Orthopedics and the Academy of General Dentistry. He has earned Small Business Person of the Year in 2005, as well as the Ron Lamb Award from Christian Dental Society in 2007. He's a certified guerrilla marketing instructor and certified trainer for Biodent Inc.'s Ultra Tooth Implant System. Most recently, Dr. Williams has been focusing on teaching about pediatric airway development, dental practice management, and the Ultra Tooth Replacement System. He's held courses on the Smiles at Sea cruises in Havana, at the International College of Craniomandibular Orthopedics, where we met, and has also dedicated his time in teaching to medical physicians and dentists in Vietnam, among several other business endeavors that he's going to share with us in this interview. We're so happy to have you here. Thank you for your time. I know you're very busy.
I'm almost retired. You know, I only work 2 days a week in the practice now at age 70. So, you know, life after dentistry doesn't have to mean you stop dentistry. So I hope we'll get to talk about how dentists can finish well and still maintain active practice, even though, you know, they're pretty mature.
Yes, yeah, that's exactly what we need to learn from pros and leaders like you to be able to afford the lifestyle, you know, that we look for. So can you start by telling me a little bit more about your background in dentistry, the value that you see in continuing education for dentists, and the road that led you to mastership from ICMO?
Sure. You know, we met along the way because Dr. Nick Meyer introduced me to you because of your unique product, the Myoaligner. And so we got to know each other at the ICMO conference, and we've been good friends ever since. And if it wasn't for CE, you know, I wouldn't know Nick and I wouldn't know you. And so CE, first of all, introduces us to some of the best people in dentistry. Mm-hmm. And traveling to different places. All my career, I spent 1 weekend a month minimum in CE.
Wow.
For 20 years, sometimes 2 weekends a month. So I would always go to work 4 or 5 days a week and then go take a class on weekends. Mm-hmm. And I really believed in it. And so I joined into the Academy of General Dentistry. I became the state president. I got my mastership and fellowship, of course. And then I got involved in TMJ real early, followed Harold Gelb, and that led me to have a whole new way of thinking. And as soon as I got into the studying of the orthopedic position of the mandible instead of the rum position that we were taught in school, I went to I went to Pete Dawson's courses. I went to courses with the American Equilibration Society. Mm-hmm. And along the way, somebody introduced me to a fellow you might know, Barney Jankelson.
Yes.
And we went to Seattle and met with Barney back in 1979. It was about that time that a study club had been formed in Atlanta called the Atlanta Craniomandibular Society. Mm-hmm. Some of the most forward-thinking dentists in Atlanta joined up to have about 14 or 15 of us in a study club founded by Justin Jones, and members of that group, Larry Tilley, Mike Durkis, Roger Melconium, a lot of famous people came out of that study club and became international lecturers. Jim Fagan in the implant world. So a lot of people learned neuromuscular dentistry back in the 70s.
Yes.
And I got my first equipment, I call it, the K5AR, the forerunner to the K7, back in 1979. And I used it every day.
I was in I was still in primary school back then.
Yeah. Well, I was fortunate to get into the CE classes in TMJ early, and that was my first love. And I became very competent at understanding what was going on and began teaching in 1981.
Wow.
And
Impressive.
then I traveled around the world teaching for about 3 or 4 years before I formed my own company. I used to teach with the United States Dental Institute, which was orthodontics. And they didn't have a TMJ course when I started it. And so I promoted to Ed Keevans, who was running the USDI at the time. I said, we could implement TMJ into this program and, have a lot more benefit to the dentist. And so that was in 1983.
Was that for orthodontists, mainly for orthodontists?
It was for general dentists and pedodontists to learn banded orthodontics.
Okay.
And that's all they taught at the time. And so once I brought up the TMJ concept, that opened a floodgate, because soon afterwards, there were 3 or 4 or 5 TMJ experts like Ralph Garcia, Larry Tilley, and others who were teaching neuromuscular dentistry, TMJ, what Farrah McCarty were doing, Brennan Stack and Larry Funt. And then there was also the functional orthopedic people, and they brought functional orthopedics into the United States Dental Institute. So we got the Witzig and the McNamara and the Dirkis concepts. And Roccabato came into the picture, as well as Ogata, who was the neuromuscular orthodontist from Myoaligner. James Gary with the Airway.
Yes.
So a whole host of people.
Giants. You're naming so many giants in dentistry that, we've had the pleasure of getting to know and following, basically standing on their shoulders.
That's who we stood on, and we learned from them. And Larry Tilley and I were in every course, every weekend for 5 years straight. We just learned it. And eventually, I set up an institute with Larry and Dennis Simmons and Dale Madsen, and we taught TMJ framework in our office for 10 years. Had a mini institute, a residency program, where doctors would come in and spend 16 days a year with us, broken out over 4 4-day weekends. And that was fun. We did that for, close to 10 years. Decided, that's long enough. We did that for a while. And then I went off and got implant trained. Got my training with Carl Misch and his Misch Institute, the first AAID Maxi course taught at the Medical College of Georgia. And that's been going on continually, for almost 30 years now. And so I learned from those guys.
Very impressive.
Continue. I went to CE classes this year, even still.
Yes. Yeah.
You just never stop.
If it wasn't because of this pandemic, we would have seen each other this September again.
That's right.
Yes. Yeah. So I know life has not been easy for you. Practice has not been easy, but all this hardship, all this struggle never stop you from learning. And that's really admirable. And I think that's the message that people should take home with, because reading in your bio, at some point you were struggling, in your practice, right?
Yes. It's not always been the picture of wonderful. The neighborhood where I practiced changed, and I had a hard time keeping staff, and crime on the neighborhood sidewalk. When they pulled a body off the sidewalk in front of our office, it's like, it's time for me to move.
Yeah.
And so I had actually started over in 1997. I'd been practicing 23 years, and I left that practice and sold it and moved to a new place. And started over. And
that takes a lot of courage. That takes a lot of courage to move on and just start.
Well, that's the message. At age 48, most people are thinking about, what's the retirement going to be like? It's not too far down the road, maybe 10, 15 years. But I started over, and I always thought, I would practice boutique dentistry and do something fun. And I didn't think I would really build it back up to a big practice like I had in Stone Mountain. But it turns out it kept growing, and we added $500,000 a year to the practice every year for 10 straight years.
That's so impressive. And then
And
bringing associates on, so you basically don't refer anything out, right? Everything is done under the same roof.
Yeah, I learned to do everything, so I kept doing it and liked it. And some people decide they don't want to do certain things like molar root canals and third molars, but I like those things, and I kept stretching myself, wanting to learn more rather than refer things out. Mm-hmm. And so it became easy to do that. And I had a dentist in my office yesterday, mm-hmm. 2 of them actually, watching me work. And I was uncovering impacted cuspids and bicuspids and putting brackets on them to pull them out from under the bone. There's things you do normally, but they had never seen that before in their practice. So they were kind of going, oh, how do you do that? How do you know where to go?
Yes. And I think that's what has kept you stimulated and motivated to do work, because it's not plateauing. You're learning new skills and you're teaching it to other dentists. You see the impact on your practice, on your colleagues, and isn't that true? That has been keeping you going, even in right now. You don't need to work, but you keep going and you keep teaching.
It's exactly what happens to make me do what I do. And I show a picture in my classes I teach where there's a curve of a normal practice goes up, and then starts to go down and tapers off.
Yeah.
But what I did a new thing every year or two. And I found that if I added something new to the practice every couple of years, I have about a 10-year attention span. That's what's been evident. I had an office 1,200 square feet. I outgrew it, and I built another one that was like 8,000 square feet.
Wow.
And I moved to that one and started with another 1,200 square foot office. Mm-hmm. And then I moved it up to another 3,000, then 10,000 square foot office. So every 10 years in different ways, I do something different. Mm-hmm. And I've been through a time where I went to missions all over the world for 10 years every year.
Oh, God bless you for doing that. That's so rewarding. So rewarding.
I teach dentists how to do TMJ for 10 years. I actually got out of dentistry, not like stopped dentistry, but I actually started doing things outside of dentistry for 10 years back in the 90s. I went to Russia and Indonesia and Greece and Colombia doing business outside of, it's like marketing business outside. Mm-hmm. So you just try different things and you see what you like. So I'm never bored. I'm always trying something new. And if it works, I do it longer. And if it doesn't work, we just move on to the next thing.
That's great to be adaptive like that. How has it been that, how have you seen technology, and incorporating technology such as digital impressions, computerized bite analysis, CT scans? I know a lot of dentists find that overwhelming, and how has it impacted your practice?
Well, let me back up and tell you, right now, I would not practice without a digital scanner. That's number one thing for me right now.
I agree 100%. Yeah.
I go from, I've had a digital scanner for over 15 years, and some of them were so bad, I sent them back. But the ones I'm using now, I love them. I got a Taro and a 3-shape trios. I can do a crown prep, start to finish, and all my time in the room is 5 minutes.
Yep.
5 minutes. And it's like, I can get them numb, I can prep it, I can impress the thing with the digital scanner. It's like, that is the easiest appointment that I ever have now. I don't really.
Same with me. I totally agree with you. Before the patient leaves our office, the case is in the lab, they're working on it, or you can have an in-house lab. And with that digital impression, it's just, you don't have to worry about pouring up models and trimming models, not coming out.
Well,
right.
There's, the way we've designed our treatment, there's no retraction cord 99% of the time. Mm-hmm. And I learned to cut preps that don't bleed so much. And that way, the astringent that I use will take care of anything usually. Mm-hmm. And boy, dentistry is fun.
Yes.
Not to have to fat cord.
Yeah. Yeah.
And
It
just
is.
works. So
We
that's
see a
the thing.
big difference between cases that we receive at Myoaligner that are digital impression and traditional impressions, you know.
Well, that's an interesting finding, you know, the full arch differences in the two.
Yeah.
That's good. Now, if you back up, the CT scan, I'm on my second cone beam CT scan that I've owned. And so those things are essential for some surgical procedures, implants, of course, impacted teeth.
Airway analysis.
Airway analysis,
Yeah.
all that.
Especially, we know now that TMJ and airway go hand in hand, you know, and we cannot just treat one and ignore the other. You know, that's a common thing that we see in our practices. So there's no just TMJ practice anymore. It's airway and TMJ.
It's amazing how that's grown so much in the last 10 years.
I know. Yeah, just in the past few years, I love that there, you know, we know that the knowledge and the research has been there for maybe more than 5 decades, right? About 50 years, but now there's more attention to airway, and it's amazing. I think it's going to impact public health mainly in the next decade. We're going to see a big jump in the public health by people just paying attention to their sleep and allowing their bodies to heal in their sleep.
Yeah, you remember Jim Gary talked about it in the 1970s, and who would have known it would have become such a big part? What he didn't have was the appliances that we have now. But he knew that it worked. He just knew that the neuromuscular bite position created quite a difference.
Yeah,
and we've gone from that.
He was way ahead of his time. He was way ahead of his time, you know, with his with that.
And the functional orthopedic people kind of had a picture of it too, because we were opening airway by expanding the maxilla.
Exactly. So how have you found that these CADCAM technology that we have, you know, we get digital impressions from the doctors, but then we have the designers that design, and then the milling machines and the 3D printers that we have these days, they're just amazing. And the quality and the efficiency that we're seeing is unbelievable. So how can you speak of how Myoaligner's CAD/CAM technology and protocols have impacted your practice and your patient's treatment outcome?
Well, it's very similar to the intraoral scanner. It's made TMJ easier, more pleasant to be a part of. You know, I started doing our own acrylic Jankelson Moras, Jankelson splints. Before that, the Tanner splint, and it was always cold cure. You know, salt and pepper on a model, make it ourselves. And so we would actually carve the occlusion in. My wife is excellent at doing the work that like Cal Moss used to do.
Oh, I do.
So that was our start back in the 70s, create our own plastic and just make a model, make a splint. And then we started shipping them out to the labs. And that's where our troubles began. Because they would never get the bite right. It would always come back different. It didn't even look anatomic. So I'm not going to name the labs that used to do that, but I always had to whittle the teeth into some semblance of anatomy, because all I got was flat planes with dimples in it.
Oh, I see.
So it was like, okay, maybe I was using an average lab, not a superior one. And so I pretty much did that for most of my career until I always heard about people doing anatomic splints. I tried a few of them and didn't like them because they weren't really that much of a accuracy. And then Dr. Nick Meyer, my buddy out in Scottsdale, Arizona, turned me on to your company, Myoaligner. And I tried you, thinking it would work because I trusted Nick. And sure enough, you know, the first one I put in worked, second one, the third one, the fourth one. Every one I put in works. And the bites are close, and some of them are perfect. And so, you know, what you give somebody is pretty much what you're going to get back.
Yeah.
So if you give a good bite and you give a good impression, you're going to get back some really ideal stuff from you guys because your CAD/CAM is accurate and you understand the business of keeping the bite where it should be.
we're milling these with the same machines that are doing our implants. So we have to be, you know, those machines offer 5-micron accuracy. You know, so if the impressions are good, especially if they're digital, the fit is amazing, especially with the segmented design. So you've seen orthotics for the past 40 years in your practice. How would you say this unique segmented design of Myoaligner? And I have to admit, without technology that we have today, we would not be able to design these segmented and get the retention that we want, you know, on the teeth. And we had to go through a lot of trials for years to get to this point. So how is this segmented design now giving you value, and how much value do you see in torque and torsion of cranial bones when patients start functioning and chewing with these orthotics?
Everybody's better in their compliance. They take to them faster, and I have not had complaints. You know, it used to be with acrylic full arch splints, there was some complaints. They didn't feel any you know, they were better, but they were not happy. These people seem to be happier. So I'm thinking that they feel better overall. They don't complain near as much. I don't have to adjust the bites near as much either. And so my appointments are short and sweet with happy people. And I think that it dictates from the fact that the appliances feel like teeth, they look like teeth, they're not embarrassed to wear them, so they wear them more. And that's one of the keys about these, is if people wear them more, they're more compliant. I think people would take my old acrylic ones out and put them on the bedside table and leave them out for a few days.
Yeah.
And with the Myoaligners, I think they wear them better. The cool thing about the Myoaligner is you can wear it with the two sides in the posterior, leave off the front. You can slap the front back on if you need to. I mean, there's different reasons people with a different curve of speed would need to have a front piece or not. So some of our patients with a deep curve of speed don't need a front piece. They just use the two sides.
That's how I have been using mine for the past three years too.
Yeah, I mean, it takes the bulk away from your speech, and it makes your bite still stable. Yeah. So I like the design that allows people flexibility to smile, eat, and speak normally, but still have the mandibular position locked in. That's a key. And nobody else ever designed one that was a triple section like yours that I saw.
Yeah, my whole point was, you know, I knew as dentists, we don't put from a bridge from 18 to 31, you know, and because I do a lot of craniosacral alignment, you know, with the chiropractors that I'm involved with, and I know more about cranial bone movement, I realized that if patients are chewing and functioning on a full arch appliance, they're probably putting some torque on the mandible. And Dr. Shapira helped me look into some research that was done on the implants in the 80s, and how implants, bridges that were from 18 to 31, the full arch bridges, were starting to fail because of the flexion of the mandibular bone underneath. So, you know, I'm hoping, you know, that there's more research done in this field, and I'm doing my job through ICMO to establish more research and show the value of segmentation when it comes to functional appliances. If you're not functioning with it, that's fine. But we know the majority of our patients clench. So if there's a full arch appliance in their mouth and they're clenching at night, they're probably exerting some force on the appliance, on the dentition, and on the underlying bone. Do you agree? I
do.
Yes. So I'm really glad that you've had great luck and with Myoaligner appliances, and I'm hoping that we can bring more awareness to general dentists, and that's my goal. You and I and other people like us have seen so much success in the past 20-30 years in our own practices that we want to bring more awareness to other dentists. That's why you've been teaching other dentists, dedicating your professional life, and kind of like what Invisalign did for ortho, and kind of like making it a little bit easier for general dentists to offer that by doing a lot of technology in the background. That's what we're trying to do with Myoaligner.
That's a good analogy. What Invisalign did for general dentists, the Myoaligner is doing for TMJ trained neuromuscular dentists. Yeah, I put the word out that if you're not a neuromuscular dentist using a Myoaligner, you know, not near as effective. And so you really do want to get the neuromuscular training to put the Myoaligner in the best position. It's called Myoaligner for a reason.
Exactly, and that's what we're trying to promote. It's a Myoaligner treatment philosophy. We are saying that you have to give us a TENS bite. You have to relax that mandible and bring the mandible to physiologic rest position, what we all learn and agree with. There's nobody that disagrees with physiologic rest position, and that's defined by having relaxed muscles, posturing muscles of the mandible. And from there, you can incorporate some free waist space, 1 to 2 millimeters, and then establish a new bite on physiologic trajectory. So that's why we only have Myoaligner available to neuromuscular dentists or general dentists that are trained to take at least a TENS bite. Not everyone has to take a K7 bite in phase 1. And that's what my other goal is. I don't want to make this TMJ treatment so complex that general dentists are afraid, to do it. I think if we have a removable appliance done to a physiologic bite, it can get the majority of our patients out of pain. And hopefully the segmented design will make it easier for orthodontists to follow the same position of the mandible and just do their magic by rearranging the teeth to support that new position. And I'm hoping more specialists will follow and take on phase 2. I think the majority of dentists are scared of treating TMJ because they don't know what to do in phase 2 and they're stuck with it. Do you agree?
Very much. Matter of fact, back in 1985, we started the TMJ framework, that little mini residency program, and we developed a philosophy called the framework orthopedic philosophy. And it was diagnostically, we wanted a 3-dimensional diagnosis of jaw position, which was exactly what Dr. Jangleson taught us to do. And we also put in there something called Jones treatment mesas after Dr. Jones, my mentor. And he said that you need to prepare the maxilla first to open it up and take away restrictions. So you got to get the width and the AP position of the front teeth first. And then he said you have to decompress the mandible, and that meant the TMJ joint, so that the condition of the joint was free to move down and forward when the maxilla had been freed up. And we used a thing called a pain relief splint, and this is something I learned from another dentist and promoted it in my teaching for the last 35 years. The pain relief splint is a bioplast material, and we create a pivot on the molars to let the jaw be freed up and also decompress at the same time. Matter of fact, if anybody wants an article that I put in the archives of the ICMO conference from Florence, Italy, 1989, I presented on that case. And there's an article I've got, so anybody who wants it, I can readily send it to you if you'll send me an email. drbillwilliams@gmail.com is easy enough to remember. So I'm glad to send an article to you. And it also has another article on the Jones treatment, MESA, and framework philosophy. So both articles are available. Both were printed for, ICMO. And then, in our other thing, we got postural alignment. Before we actually finish the case, we want postural alignment.
Yes.
The whole body, the jaw, cranial bones, all that, ideally. And then we go to finalization. And your appliance helps test for finalization better than anything I've seen. So I can take your appliance, duplicate that position, and create my crown and bridge or my orthodontics to that specific point.
I always tell the patients this is a good way to test drive a new bite before you commit to anything permanent like full mouth reconstruction or restorative or ortho. And you brought up a great point. I always tell my patients TMJ is a postural issue and it's an airway issue, so we always evaluate the posture, we always evaluate the airway. And the complexity and the beauty of it comes when you have to decide, okay, do I need to open up the airway now or do I need to address the TMJ? And Dr. Tenen and I, Dr. Tenen, my partner, is a Vivo's instructor. We've been collaborating under the same roof, and there's a lot of cases that we have to look at and see, okay, what is the chief complaint of the patient? Do I need to address the TMD, put them in a Myoaligner first, and then open up the airway, or is it more of a mid-face deficiency, an issue like that? So that's where I think the dentists need more training to see where to start first. You know, and we always want to start with something that is non-invasive and gives the patient a chance to test drive a new bite, you know, and that's why I look at Myoaligner or as phase one, or it can be a diagnostic appliance as well as a therapeutic appliance for some patients, but we'll set the foundation for more long-term treatment in the future. So we're trying to set some protocols even for Vivo's doctors that are seeing TMJ patients, and we actually videoed how we take a TENS bite and made that available to Vivo's doctors, you know, and you can actually incorporate a TENS bite into your functional orthodontic appliances or orthopedic appliances. So sometimes if the patient doesn't have a lot of TMJ issues and that's not their chief concern, when we make our DNA appliances, we at least take a TENS bite and incorporate that into the occlusal pads. And we've seen great results with that. So we hit two birds with one stone that way. Yeah, so.
Agree with that, yep.
This brings me on to another subject, which is business training, you know, and as we know, most dentists, you know, don't get any business training at dental school. I was a top honor student at OHSU, and by the time I graduated, I felt like I didn't get even one class on business training. Yet, majority of us dentists end up having to manage million-dollar practices with employees, you know, with all kinds of regulations that we have to deal with, and marketing, and that's the most frustrating part of the job when I talk to the dentists. So I would like to know what specifically interests you about the business of dentistry, and what's your advice for dentists that are struggling?
Yeah, back in the days of teaching TMJ framework, we tried to be pretty comprehensive, and so I started talking a bit about marketing in terms of how to bring your TMJ practice into the general practice. And so the more I talked about it, the more I liked it. And so I gravitated towards the business side of dentistry. In our team, we had 4 dentists that were teaching with some guest speakers. And, you know, eventually I started dropping out of the TMJ teaching and doing more business teaching. And when I started my new practice over in Suwannee, we had such a phenomenal growth, and I had already been teaching and learning about the internet. And so I started building websites for dentists back in 1998. Wow. And I was a webmaster for dentists for a long time. And so with that good run of business savvy marketing, I started, you know, writing articles. And those articles were basically how I marketed my practice from 0 to $5 million in 10 years. And I put the book together, Marketing the $1 Million Practice, basically stringing all those articles together into a book with a forward and an afterward. And that's where the book came from. And so that tells how to market and build a practice to get new patients and make them happy. It's taking care of the people in the practice as well as getting new people in the door. And so I described our new patient experience in detail in that book, how we actually came together. You know, one of the parallel pathways that I accomplished my dental growth was I went to Omer Reed, I went to Rick Mercer, I went to Dick Barnes, I went to a whole bunch of different practice management classes, starting with Quest back in 1981. And so I always married together the business and the practice management side of dentistry along with the technical. And I started teaching what I was learning in the management classes along the way. And, you know, I still maintain that what I learned in the management classes was far more important than what I learned in the technical classes as far as us being successful.
Yes. Oh.
A lot of people don't put any weight on management being important.
No.
But you really need it if you're going to actually serve the public in a better way. And so that was the macro type of build the business. Mm-hmm. Then I started teaching the mastermind classes, and the mastermind class, like this is the mastermind logo. And what we did was, based on the $5 million practice, we said, how do we teach people to do what I just did? Mm-hmm. And we said, well, let's do a mastermind, because Omer had talked about the mastermind, and I've been in some masterminds, and I wanted to do another one. And we had phenomenal success. And one of the things I did in that mastermind was the very first lecture I gave was the lecture on how to be successful mm-hmm. and create the perfect day. And, I didn't really have a lecture material put together for the first mastermind. I just started talking. Mm-hmm. And I had to put together something to show them. I said, okay, I've been successful in being productive every day. $10,000 a day average for 15 years.
That is amazing.
Yeah, it seemed like it was different from most of my friends. I go, this might be something to teach. Mm-hmm. So I put down 50 things I do, think, or believe, and my staff do think and believe, and on a list. And I basically read the list to the guys in the mastermind on the first weekend. And I thought, that's going to be good for them. They'll see what I do. Well, it turns out that everyone in the group started doing $10,000 a day pretty soon. Wow. And some of them did it every day in the month pretty soon. And so it dawned on me, this is very important material to teach, because everybody's not doing $10,000 every day. So I go, okay, I'm gonna make it a book. And so we came out with the second book, $10,000 a day dentist, obvious topic, obvious title, because what we want to do is get across that this could be your average day, not just once every, 3 months. Everybody has $10,000 days every now and then, but my goal was to have normal dentists do it every day, not just your superstars that do full mouth reconstructions or all on fours. That's not real dentistry.
And that's not just working hard, that's working efficiently and following, a system, having system in place.
It's all about systems, and it's all about understanding people. A lot of what's in the book is how to understand a person. If you understand them, they will get what they need. And, they need that much work. Mm-hmm. For the most part, people need a lot of work.
Yes.
And so you can teach people how to understand you can teach dentists how to understand people and relate to them. That's a lot about what the book's about. Mm-hmm. So I enjoyed putting those two books together, and it's been a labor of love to be in the mastermind teaching space, for 10 years now.
Mm-hmm. That is so impressive. I'm so impressed that you've impacted so many lives and continue to teach and spread the knowledge. And you and I have talked a lot, and you see a lot of value in having you see a lot of value in having a diversity in your financial portfolio. And I know besides dentistry, you are also involved in other businesses and business endeavors. So please share a little bit about that with us too.
Yeah, there's a time where people used to think I could be a dentist and that's all I need to be. Mm-hmm. Well, I was a little too bored to be just a dentist, I guess, because I went to Russia and Indonesia and Colombia and Greece for business during the 90s.
Yes.
I just wanted to do something different. And so I saw other things. And then in the 2000s, I started going into internet marketing and learning what those people were doing, as it was a new thing, internet marketing. And I got involved with Glazier Kennedy, Armin Morin, and I even got certified as a guerrilla marketer with J. Conrad Levinson, just because I wanted to learn something from a different perspective. Mm-hmm. I took a business coach and hired him to meet with me every Friday for 4 years. Wow. From the Action International Coaching. And he was a Australian coach. And I just learned all the things about what business people do, not dentists. And that really did serve me well to get outside the dental box. And so what I found was there's a lot of ways to make money other than in dentistry. And even Steve Parker and I got together on this article in the Profitable Dentist magazine about side gigs. You know, why would a dentist want to have a side gig? And it was pretty appropriate because it came out in December of last year, right before COVID took a lot of dentists out of the picture for 6 to 12 weeks. We sat on the sidelines while we were called non-essential, right? Mm-hmm. And it's like, no, I'm essential. I mean, I do good things for people, right? Mm-hmm. But I couldn't go to work because the government mandated we stay home.
Yeah.
And what happened was all my side gigs were paying money, even though dentistry was not. Mm-hmm. So I go, okay, this was a good thing that I was into. So I had about 5 or 6 different side gigs that I was running. You know, I've got a SIA not a pharmacological, a nutraceutical, which is like tremendous for many, many problems that people have with their bodies. Mm-hmm. Anti-aging, youthful, it makes your skin go back to, you know, turning over every 28 days instead of every 70 days. Mm-hmm. As you get older, your skin turns over slower. Mm-hmm. But when you put this on the skin, it goes back to this normal glow, this normal non-wrinkled appearance. And so it's literally physically changing your skin, but it's doing the same thing on the inside. It's making your arteries softer and not get hard. It's making your pituitary gland, your other glands, every hormone works better. Mm-hmm. So I mean, there's a whole bunch of things that are going on with that. So I enjoy telling people about the health and wellness aspects of some products. That's one of them.
You implemented in your marketing site, correct? And you saw changes, healing, much faster healing. And
yeah, you know, if I see something that works, I'm going to tell my patients about it, and I put it into the practice. And I found that implant cases went much better. Any surgical area healed 2 or 3 times faster. Mm-hmm. And if they would take the product routinely before treatment and then after treatment, tremendous improvements. You know, I had people that had 4 implants, 7 extractions, had no pain post-op, and their bleeding stopped immediately. I mean, all kind of things happen when you have that particular product in place. And I, you know, I've written many articles about it on Facebook and different places about how that has impacted our practice and our patients. Mm-hmm.
And
so those are the main things. You know, I got involved in recommending good things. So for many years, I've been a Wall Street investment advisor. Mm-hmm. They ask me about what's going on in dentistry, and I do an interview with them or fill out a survey. So that's an income center. Way long time ago, I was an insurance adjuster. I didn't like that though, because that was kind of like, those guys only want people to turn down claims. And when I kept paying claims, they finally fired me. So I figured out their game pretty quick. They don't hire people that won't do what they ask them to do. Yes. Interesting. I recommend marketing software products that I like. Mm-hmm. Sometimes I have a affiliate relationship with them, and sometimes I don't. But the main thing is I just recommend things that I think work. Like with the Myoaligner, I'm not connected with you guys at all financially, but I still recommend you. I've got other things that are marketing that I get a little bit from if somebody likes it, but they're always so successful that I enjoy doing them, you know. So if anybody wants good marketing tips, you know, I've always got people telling me what they're doing, so I know what's the best of the best.
I agree. How can dentists reach out to you and and learn more or sign up with your classes? What are you recommending right now? Or
yeah, that's a good question. You know, what we're doing now is I'm working closer with my son, letting him take the flag, carrying the flag to battle.
Wonderful.
You know, my son has been working with me 10 years in the 5M Mastermind. And he's been getting better reviews from the dentist than me. It's like, this is pretty serious stuff here. When they voted his lecture better than my lecture, they go, okay, it's time for him to take over some of the reins of management. And so it's called practiceperformer.com. So I want to put that note out to the guys listening to go to practiceperformer.com.
Okay.
And look at what Tyler's doing, my son, and I still teach with him, you know, but it's like, I'm gonna let him carry that flag for a while, see if he likes it. If you really want to know what's got my interest in what I'm on fire about right now, it's the OnPassive and GoFounders. OnPassive is a new IT company that's launching that is automated, and it's completely done for you type of business that any business can apply the product, the marketing products, traffic to drive traffic to your business. And you don't have to touch it. It just runs by itself, and it just makes money for you. So that's kind of what I'm interested in right now, telling people about. And the unique thing is that GoFounders, which is the marketing arm of it, is still accepting founders. And so, you know, not only can you get a good product to use in your practice or your business if you're not a dentist, you can actually become a founder and have a cash flow that's like better than anything I've ever seen. Mm-hmm. We have a little catchphrase called CATMO, complete automated traffic makes money.
Of course, there is a lot of value in digital marketing and using, you know, the social media platforms and things like that. As you know, I've been involved in DevRai as a co-founder and board member for the past 4 years now, and I can see firsthand what these engineers and code writers can do to make our lives much easier. It's unbelievable. You know, we have our expertise in TMJ and full mouth reconstruction, all of that, and they have their expertise, you know, in making life easier for us, you know, and protecting us, you know, and reaching out, you know, through marketing is so valuable. And we're past the time that we send flyers to the patients and welcome baskets, you know, and things like that. There is so much value in digital marketing these days that I think most dentists should take advantage of and just be able to spread the word to thousands and millions of people instead of just their neighborhood.
Yeah, I mean, the question is, how many people do you want coming to your website, mm-hmm. to your YouTube video, to your Facebook page? I mean, it's all about traffic. If you got a good product and you announce it well. Let me show you an example. This video that I did right here, mm-hmm. all I did was get a electronic board that I can write on, and it turns iridescent blue.
Oh, fun.
And that's something. And I talked for about 15 minutes about OnPassive. And I shared with people what I was seeing as the future. Mm-hmm. And in 6 days, that got 59,000 views.
That's impressive.
59,000. Mm-hmm. And this is because of the viral nature of what we can do now with marketing.
Yes.
And so I think a dental office could saturate the local environment with videos, mm-hmm. like that. I mean, I have the capability, being a founder, to do it for free. Now, I want to repeat that. If you're a founder with OnPassive, you can saturate the market with your business information for free. Mm-hmm. Because as a founder, we have special rights and privileges. And so I just want to tell you that it's beyond unbelievable that you can get this kind of service from a company that's done for you and it's automated.
Nice.
All you have to do is, you know, you have to cut the video itself, put it up on the website, and it runs all by itself after that. And what they tell me is that you can get 1 million views if you're talking about large distribution. I don't think there'll be 1 million views in Atlanta, mm-hmm. but there might be 1 million views around the world.
Yes. Yeah, and you don't need fancy equipment, or, you know, you just, you know, you can just speak like you did, just like, you know, in front of a board.
Just
and,
yeah. Let me tell you, if you want to get a hold of me and see what I'm doing with all that, just go to Dr. Bill Williams OnPassive Leader on YouTube. You know, you can just check out my channel, mm-hmm. and check out Facebook. Of course, I've got the 10K Day Dentist Facebook page. I've got 10K Day Dentist podcast.
Mm-hmm.
You can find that on all the podcast stations, Apple, iTunes, different places, Spotify. So
That's
I'm
great.
happy. I'm just working. I say I'm working 2 days a week, but I'm working all the time because I love doing what I do.
No, you work Saturday mornings, Sunday mornings. You're always there. But I think it's because you're so passionate about it. It's not work for you. It's
No,
just so rewarding. And what else are you going to do? You're just sitting there by the pool. So why not use this phone and connect with millions
yeah.
of people?
You see my stuff online all the time, and I'm posting stuff constantly.
Yes.
If I didn't believe in something, I wouldn't be posting.
Oh, of course, I know.
If
Yeah.
if I didn't believe someone would help somebody else, I don't need the help.
Mm-hmm.
I really don't need money. All I need is my kids to do well, my grandkids to do well. So that's the motivation I have.
Yeah.
All I want to do is grow old and not be, unwell.
Mm-hmm.
That's the main things that I've got facing me in the future.
That's wonderful. And I'm so glad. I'm just honored that you shared your life, you shared your experiences, and you're willing to reach out and help other dentists, be successful like you've been. And I really appreciate your time this morning with us. And I'm so glad that I got to meet you through ICMO and meeting some wonderful people and mentors. And I'm forever grateful for that.
Yeah, you're welcome, Miriam. You're one of the rising stars of the dental profession. I saw it in you immediately, and you're innovative, you're dynamic, you're dedicated. You've got all the qualities, and we need more people to stand up and be counted. There's a lot of need. Dentists as a whole aren't trained enough in the areas that you and I really think are important. This neuromuscular stuff is way too important to not be front and center as it should be.
And it is so needed. On average, conservative estimates say about 25% of patients in each practice complain of TMJ pain and headaches. But unfortunately, majority of them just walk out with a night guard that is not therapeutic.
A night guard is, listen, Dennis, a night guard is not a therapeutic device. It's a Band-Aid because you don't know what you're doing. I hate to tell you, but you don't know what you're doing if that's your version of TMJ treatment.
And in some cases, in fact, if the problem is airway and you put a flat night guard and an upper arch, you can actually slide that lower arch further down towards the throat and cause the sleep apnea and that, and grinding and clenching even more worse. If you see a patient that's complaining that things are getting worse with a night guard, that's because they're struggling with their airway closing. And so there's a lot of value. You're going to help your patients when you learn more about it. You're going to help your practice. And imagine in an average practice that has about 2,000 patients, if 25% of patients are sitting there and not getting the treatment, that's 500 patients that you're ignoring and you're just watching them suffer. First of all, you can help out those patients. Second, 500 patients times about $3,000 or $4,000, which is an average treatment on dental practice. What is that? About $2 million of production that's sitting there.
As a few dollars.
That's a few dollars. That's
yeah. Hey, that brings me to the last point I wanted to make. I talked about the $10,000 a day dentist is a good number, a good round number for a very successful practice per dentist. I go, what if a layperson could do that? Mm-hmm. What if you could train a layperson, show them how they could do $10,000 a day in income? Mm-hmm. Well, that's what I've got in on passive. I just want to lay that one on the floor. I can tell people that there's $10,000 a day being made mm-hmm. in internet marketing and internet business, and it's coming. 2021 will blow your socks off with what's coming, because on passive launches in 2020, which is only a few months, to the end of it. So we're very close, and I want people to understand the word on passive. If you hear it and you're not involved with it, probably should talk to me about it, because it's pretty important stuff.
Yes. Thank you,
Thank
Dr.
you,
Williams.
Thank you, ma'am. Very good to be with you again.
Yes, same here. Thank you. Bye-bye.
Bye, everyone.